Welcome to my channel. Today we're going to review a very interesting paper that was published in the Journal of Pediatric Cardiology in May of this year. There has been not many papers on pulmonary artery development over time in severe Ebstein's anomaly in patients who have undergone a Starnes procedure. Reviewing Ebstein's anomaly, as we know, you have a apical displacement of the tricuspid valve and severe regurg. Some centers, like our center, do Starnes procedure where you create a tricuspid atresia and then eventually perform a complete Fontan procedure. Now the question is, what happens to the pulmonary arteries over time in these patients who have challenges with pulmonary artery size, lung size, and respiratory problems early on in their life? So that question came up in this paper and has been addressed nicely, though in a small number of patients. They followed patients who have undergone a Starnes procedure for 3.8 years for severe Ebstein's anomaly and compared them to a similar group for 4.2 years for patients with pulmonary atresia with intact ventricular septum who has undergone a single ventricle palliation. The survival graph here shows that between 14 patients with severe Ebstein's anomaly and 36 patients with pulmonary atresia intact ventricular septum, the survival of patients are lower in the group with Ebstein's anomaly. And when they compared the Nakata index for pulmonary artery size between the two groups, there was significant difference in the pulmonary artery index or Nakata index over time. Now the question is, why? One explanation the authors give here is that because of in utero cardiomegaly, the lungs cannot develop, so they start at a lower point. They get early shunts, and some of these shunts are smaller than some other conditions and therefore do not help the PA to grow to its full potential. The other problem that the authors noted is these patients get LV dilation, and one of the hypotheses is that because of the small pulmonary arteries, there is increase in number of aeropulmonary collaterals that causes excess blood flow to the ventricle, causes LV dilation. So over time, when these patients had a Fontan procedure, their left ventricular volume went down. So the authors conclude that central pulmonary artery growth is poor in patients with severe Ebstein's anomaly compared with that in patients with similar ventricle condition. Patients with severe Ebstein's anomaly should be carefully monitored in this regard before and after the Fontan procedure. Of course, further studies regarding long-term prognosis is expected.